Hello guys, welcome back to my channel. I want to start by apologizing because I was away for a few weeks, and the reason why I wasn't able to upload videos in a constant basis these few weeks is because I was getting ready for my final exams. So we had back-to-back exams and I was falling behind. It was hard to catch up, so I needed to take a break from this video. But I want to give a thumbs up to all my subscribers. If you have been watching me, if you have subscribed, thank you for bearing with me. Now I'm back and I'm gonna feed you guys with everything that I know. So the purpose of this video is to first announce you guys that I'm officially done with my first semester in CRNA school. Yay! I couldn't shout louder, but I feel like it's a great achievement. I'm grateful, even though it's a little step, but it's a step ahead, right? And if you are somebody that is planning to go into CRNA school, or you know people that are going to CRNA school, or you just want to listen, this video is going to be very interesting because I'm going to dissect what I went through my first semester. Hopefully others don't make the same mistake, or to better prepare others that are wishing to go to CRNA school. Or if you just want to listen, just stay tuned. Now, in my first semester, I had 5 courses. Yes, 5 courses. The first course was basic pharmacology, and I want to say it was not pharmacology for anesthesia yet, but it was the fundamental to grasp the basic for pharmacology. But it was also different from the pharmacology that we learned in nursing school. The second one was anatomy and physiology. So it was still also the basic. It was very similar. If you were a good nursing student, you won't struggle that much with this because it's the same anatomy for me, and then physiology, they had like some specific that you could learn better. And also the bedside as an ICU nurse could also help you with these lessons. The third course I had was chemistry, and it was chemistry for anesthesia. So it was also a mix of organic chemistry a little bit, but the most part it was very chemistry for anesthesia. And the fourth one I had was anesthesia equipment. This is a class that basically you learn about the equipment you're going to be using in your career, and you learn about how they work. It was very abstract, but I'm going to come back to it. And the fifth one was evidence-based practice. Yes, from, I don't know, I think it was from 2017. I'm not sure, don't quote me on this, but all the CRNA program are required to be doctorate, so we have to make those papers and writing and all the good stuff. So that was the class that also I had to take this semester. So 5 courses in total. So I'm gonna start with the first, pharmacology. So like I said before, it was a little bit different from what we learn in nursing school, but it was basically the principle of pharmacology, like what you need to know when you hear about a drug, how even to recognize those drugs, what are you looking for when you administer the drug, what are the indications, and what could possibly go wrong, you know. Now, these drugs were not specific to anesthesia, but some of them were like the stuff we use every day also in anesthesia, like phenylephrine. But when I said it was basic, because it wasn't just anesthesia farm meds, so we had a little bit of everything. We talked about beta blocker, beta agonist, we talk about all the classes of drug except maybe the antibiotics, but we talk about the basic like pharmacokinetic, what is a half-life. These are the stuff that you're going to learn and see how much you need to know, because once you know their value in your daily practice, you will want to know. So you're going to learn about half-life, you're going to learn about bioavailability of a drug, pharmacokinetic, why is this drug better absorbed there than here, and why is this drug don't cross the brain, why is this drug can be given into a pregnant woman and not this drug. So all the very chemistry of the drug. So pharmacokinetic, pharmacodynamic, it was the main point in this pharm class. So in the pharm class, we had 4 exams, including the finals. Our finals were not cumulative on pharmacology. The first exam was a little bit like a shock because you tend to think like you were in nursing school. You tend to think, okay, this is the form that the exam is going to come, but you're actually going to need to think out of the box. So like if your professor gave you a slide of maybe, let's say, 89 pages, actually you are not going to just take learning those 89 pages. You will have to go look for article to increase your knowledge, because he's not gonna ask you just the question on those 89 pages. Those 89 pages are gonna be the foundation for you to go look for the answer of other things. So you're gonna have to incorporate all of your drug, like in clinical scenario, like, okay, if I have a patient that is coming and I need to intubate this patient, her blood pressure is high and she has liver failure, why shouldn't I give esmol? Why can I give esmolol instead of another beta blocker like propanolol? So you're gonna have to start thinking like that. How is esmolol metabolized? Is esmolol metabolized in the liver? No. It's propanolol metabolized in the liver? Yes. So you're gonna have to start integrating everything together. Or if your patient is probably taking anti-epileptic drug on a regular basis chronically, and you want to know what kind of anesthesia drug you can give safely, or is this anti-epileptic drug is going to prolong the duration of action of my anesthesia drug and probably give me more toxicity, and my patient probably not going to wake up on time. What is my backup plan? If this happen, what can I give? So these are the things that, so it's not just about reading the book, but it's actually reading and putting it into a real critical scenario. So this is what this pharmacology semester was about. So another example that I can give is, if you have maybe a patient that is taking multiple drugs, and then you want to know like the side effect, am I able to give this with this, or why can't I give this with this? And some of the answer will not have explanation. Like if you think about apomorphine is a drug that we give in Parkinson, and you have your patient with ondansetron, and you have a patient that you want to give ondansetron to prevent nausea and vomiting. Ondansetron is also called Zofran. Why don't you want to give both together? Because they don't work together. You can never give both together. So some of them, it's not about the rationale, will just be study have proven that if you give them together, you're gonna have hypotension, bradycardia. So, and you need to know all of this. I know it's gonna be a bunch of information, but for me, what did work for me is to put it into a critical scenario. Like every time that I read about a drug, and I try to put my drug together and see why can I give this instead of this. And something also very important, I know I talked about half-life earlier, but I want to very emphasize on half-life, because half-life is gonna determine how often you give this medication. Like if you give a medication that has a half-life of 6 minutes, so you know if you have a case of 12 hours, during those 12 hours you're gonna have to give that medication maybe 3 times, and you want to know where this medication is going to be excreted, because let's say the medication is going to be excreted in the liver and your patient has a liver issue. You don't also want this medication to accumulate. What is the alternative? Why is this going to be better than this? Or if I don't have any alternative, what is my backup plan? What if something happened? What can I use to alleviate this issue? So these are all the stuff that you're gonna be learning, but don't get frightened, because actually I was very lucky to have a great lecturer. Like my pharmacology lecturer, he was perfect. He was on the top. His slides were like very repetitive, so you can really understand the information, and he was emphasizing on the stuff that you really need to know. And I did not really struggle with this course, and this is a course that I loved reading, but I spent less time on it because it was very straightforward. The only thing I had to remember was the thing that I couldn't, like, they were not like a mechanism of action to understand, so I had to commit it to memory. So these are the only stuff that I would spend time on, but I didn't have to spend time a lot on the basic mechanism of action, because he was doing a great job. His slides were very easy to read, very understandable, straight to the point, and he will even provide you with like references. Like if you want to read more about it, he will give you articles and stuff like that. And my book, my pharmacology book, also was very simplified, very easy to read. So I did not struggle about this course, and it was my number one, my top course to go. So yeah, and one thing I want to say also that really helped me with this is by understanding the concept and putting it into a clinical scenario. Don't just read the slide, but read over the slide. Read this slide like you have a patient that has that condition, and you, the provider, the anesthesia provider, you have this drug. What do you need to know about this drug? And this is how I was approaching my pharmacology course, and it really did work. So guys, and also we were having like the drug cards, like farm card, like we did in nursing school, and it was also kind of okay to retain the information, but really I wasn't studying that much for this drug card because it was open book. But the main study that I was doing was with my slide and my book, and I will study in a critical manner. I will not study just to study the slide. So I think I spent a lot of time about pharmacology. You guys should be tired by now. So let's talk about the second one, that was anatomy and physiology. This also, I will talk about anatomy first. The anatomy part was really easy because it's the same thing that we saw in nursing school. You just need to like revive that information. I know most of us, or most of you guys, went to nursing school a long time ago, but still it shouldn't be difficult. Anatomy never changed. Once you know where this is it, where this muscle or this nerve, this arterial branch or whatever, once you know it, it never changed. It stays the same. So the only thing is that I want to say, do not procrastinate, or do not just, what you don't know, don't just put it behind and say, okay, I don't know. No, try to know. Like if you studying about the brachial plexus, let's just take an example, and you get stuck because you don't know which branch come from. try to know, because behind knowing that branch you can know a lot more, and that's how you keep on stocking the information. You keep revealing the information, and the more you relieve, the more you feel stronger. So, and just take your time and understand like which muscle before which. The part that was really a little bit different, it was when we start talking about the airways anatomy, because this is what we're gonna do, guys, and our professor really emphasized on the anatomy of the airways. So it was quite different because it was very in depth. So we went over every little muscle, every little cartilage, every little part of the innovation and stuff like that. But and I don't really regret, because once when I watch this video on YouTube, people intubating, and you really want to know your anatomy. So this is the only part that I found that it was a little bit different, but anatomy is not really heavy. So once you know your brachial plexus, lumbar plexus, sacral plexus, and your airways anatomy, I think you should be good to go. So don't freak out. Now let's talk about physiology. And like I said, this was the basic of physiology. For most part, like the cellular function, what are the gap junction, how the muscle work, how the neurons works, like the kidneys, the nephrons, the anatomy, the physiology of the kidneys, how the urine gets formed, how the proximal tubule work, how the ends of Henle and stuff like that. So it wasn't really difficult, but the part that I said that it was a little bit different is because we started doing a little bit of math just to know, like, but it was very basic. You're gonna have formulas, and you're gonna, once you retain your formula, because you have to commit them to memories, there are a lot of numbers that you will need to commit to memory, but once you retain those, you're gonna be good to go. So, and also physiology can be very like wide, it's very broad, it's gonna be very high in length. So just don't procrastinate. Whichever method you are using to study it very well, because it's very broad and you don't know what is gonna come on the test, but you need to remember everything. So I can't say that I really excel on this course, but I also did not really struggle. So it was kind of in the middle, and I was just going with the flow. So it was very interesting. And also I had to dig a lot for my physiology course into YouTube videos, because my book is very basic, especially when it comes to this basic of physiology. It talks more about pathology, but at this stage of physiology, my book was really basic, and I didn't have something to test myself like study guide question and stuff like that. And you don't get that in school, anesthesia school, like in nursing school. So I was going on YouTube, watching other instructor video about the same topic, and I learned a lot. I really learned a lot this way. So I was before, like, I wasn't just sticking up to my slide that I got from my lecturer, but I was also going into YouTube videos and find information out there, and then combine both to better understand. Yeah, so physiology was okay. Now let's talk about the third course, was anesthesia equipment. So this was completely new, never done that before, and it was very abstract. When I say abstract, it's like the book is like you can even understand, like the book is just jumbling everything up. It's not organized. I'm sorry to say that, but the book was not helpful, not even a little bit. And then, because at this point we haven't started clinical, my clinical is going to start on the 5th semester. So everything we were doing, it was just lab and trying to understand. So it was very abstract. We're talking about this machine and what this does and what this does, but you don't even, like, you don't have the machine in front of you, and you just rely every 2 months to go to the lab and actually see those machines, and probably you don't even remember this information. It was very abstract. But what helped me, I had a great instructor. So my instructor, he is very straight to the point, and he will pick the stuff that we need to know, and then when we get to the lab, he's going to extend on those stuff. So it was abstract at first, but then when I kind of understand his flow and where he was leading us and trusting him, and to be honest, I didn't open that book again. So I just went by his PowerPoint and what he was saying in class. And what I think helped me too is because he was recording his cases, because he was also a CRNA. So he would go to work, record his cases, and show us the video, what went wrong, what went right, what he did, and what he should have done. And that's really what helped me kind of put the dots together. And also, we have some kind of like app that the school provided to better understand this. We have a great app too that was kind of doing some videos and pointing while talking about part of the machine. And the main thing is the machine check. So this is how our evaluation was on this particular course. We did a machine check. I think it was after 2 intensive. So after we went to the lab 2 times, we had to get evaluated on the machine check. Basically, you have to show them that you know the part of the machine. So as an anesthesia provider, when you come in the morning, what do you do? How do you set up your machine? How do you make sure everything is okay before you even begin your case? And you really had to verbalize. And also, we had like cases like he's gonna kind of, so we come in the morning and he makes sure something is wrong on the machine to make sure that you know what to look for and fix the thing. So it was really fun. And I think that I still have a long way to go, but I also believe that I did grasp a little bit that I needed to know for this class, although it wasn't to the perfection. But I feel like it was just an introduction to the topic, and I'm eager to learn more. But this is one of the lecture that was really different for me. I never heard about it, never saw that in nursing school, and it was so abstract in the book. Usually I love reading my books, but this book, no, I put it on the side. It wasn't gonna work. The book was so disorganized. And yeah, so because it was an introduction, I'm not panicking, I'm not anxious. I trust my instructor, I trust the university, and I trust all the resources I have. And I know that on the long run, I will do better if I keep doing what I need to do. So I'm just gonna have to learn more about this material and familiarize myself with the machine. And also, another thing that we were doing in this particular course, the anesthesia course, was also the intensive, like the time that we're actually in the lab. So in the lab, you're gonna have to kind of know your part of the machine. I talked about this. You also want to kind of intubate on your mannequin, put the LMA, use the laryngoscope, all this equipment you're gonna learn that. You're also gonna learn how to don your steel glove again, and also yeah, a lot of things. You're also gonna learn the basic about hand washing again, like we did in nursing school. But the main thing that you really gonna focus on is to know your machine part. Is also to try to intubate on your mannequin using your gyroscope, and try to put an LMA, get familiarized with all these equipment, and see and understand when you need to use this instead of this. What is this? What kind of complication you can have with this? And same thing for the machine. You need to know how to do a complete check on the machine, when to call on maintenance, and when it's not related to maintenance, what can you do at your level. And you also need to understand your gas, because anesthesia works with gases. So you're gonna have to, and this is a part where chemistry also kind of blend in together, because in chemistry you're going to learn all these gases and how you make the math, and then you're going to bring that knowledge into your anesthesia machine and understand how you do your mixing and everything, and why we do this and this is. And I feel like, yeah, I still have a long way to go on this particular course, but I don't complain. I'm very grateful for my lecturer, because he made everything so straight to the point, like very down to earth. And yeah, and these cases that he was bringing in class, that was a blast. Everybody was so happy that we were able at least to see and understand what was going on. And yeah, and he was very open to questions. So yeah, now let's start. Excuse me. I think I'm talking too much tonight. So next is gonna be chemistry. So guys, chemistry, what I want to say is that even if you've never been somebody that like chemistry, this chemistry is actually sweet. And what I mean by sweet is the things you're gonna learn, because most of them pertain to your career, is gonna be math. Yeah, a lot of math, and also a lot of number that you will need to commit to memory. Like you're gonna calculate the pressure of oxygen, and don't freak out. You're gonna learn everything about it. Just make sure you do your part. Once you're learning, practice, practice, practice. What really helped me about this course is my lecturer. Like on every single math problem, he was very patient, because we had we had an uh, we had a lot of students in my class, and everybody was not on the same level in math and in chemistry and all that. But he had a lot of example on his slide. Like you didn't even have to go in the book for his lecture. Like he would put like 3 example on the same math. And so it was, at first when I was listening, when I was hearing about chemistry for anesthesia, I was freaking out. But it's actually very easy. It was the easiest course that I had. Like I'm not like excellent in math or chemistry, but it was just very easy. And then the book also was so helpful. The book was very organized, and then at the end of the book you have those practice questions with the answers. So I didn't have to go too much in the book, because the book was very broad when it comes to the topic, but my instructor was picking the stuff that we need to understand. So going into the broad book was just wasting more time of the time that I don't have. So I was just focusing on my instructor PowerPoint. I will review the example that he gave, and then do the exercise at the end of the book. Not even all the time, just maybe 2 or 3 times. But it was the easiest, because It's like once you know your formula and once you know your conversion, because for many people it was not about retaining the formula but also the conversion. You're gonna have like 6 things that you need to convert. So like so you really need to know all your conversion, and you're gonna be provide with all this conversion, and this is the best thing. So you don't have to dig in there and there. Once you know your conversion, know your formula, practice on your question, and it's gonna be the easiest. So yeah, and I think that was the only chemistry that we actually gonna have in this whole program, but it was sweet. I didn't, and then we also had the part that we didn't have math. We were talking about radiation and stuff like that. And I didn't really like that part because it was also so abstract to me. There were no math. They were talking about X-ray, magnetic thing, and all the stuff. So but for the most part it was fine. It was the easiest for me, and I didn't have to spend much time studying it. So, and the last but not the least that I want to talk about is gonna be evidence-based practice. Evidence-based practice. This class was mainly writing. It was my hardest class, and in this class I had the lowest grade, but I still passed the class, guy. But it was a lot of writing, like every single week you have to write something. And my point wasn't just writing, it was to dig into the articles that, and I didn't have like time management was a big deal. And then you have to read through like 8 articles and summarize them, and sometime I will go like through 20 article and I don't even find the essence of what I want to talk about. So that was my main, it was the course that I struggled a lot with, because I was wasting a lot of time reading through the article. And then at one point, like after reading through 3 4 articles, I just had to get out of that and do something else, because my brain was like, okay, I can't take this anymore. And then also I felt like it was taking too much of my time, right? Because I also had other courses that I needed to focus on, and here I am reading about 20 articles and I have to summarize them, and also the AMA format, because when I was in nursing school, we were using the APA format, but here my school, excuse me guys, my school is using the AMA format. So it was a new format for me, and in the beginning I was struggling. I had to buy the book to understand how it works, and then even after I had the book, I still had to go like, I made some mistake on my references, how to write down the references, and I was losing point. So I'm not still an expert, but it was really challenging to me. And it was just like looking for the things that like just spending so much time, reading those articles, summarizing them, and then write down, typing, and then check out your grammar and all the good stuff and your references before you submit. And then also we had discussions, and you have to respond to your peers. And so yeah, I felt like I lost a lot of time, and but the good thing is that I did improve from my first discussion or my first assignment to the last. According to my professor feedback, I was making some kind of improvement, because every time that he will grade, he will tell you why he graded you this way, and you just got to work on it to improve your grade. But it was just a very challenging class for me, and I spent a lot of time in the beginning. Like I would spend like 2 days to write down my paper, and you have to write like 4, 5, 6 pages, excluding the reference page and the introductory pages. So it was really kind of like challenging to me. But yeah, I feel like this is a little bit of achievement, and I am gonna make the most of my break. If you have any question or any comment, or maybe you went through this already, or you are already with CRNA and you want to give me an advice, please leave your comment down below, like and share, and stay tuned. I'm on break and I'm gonna explode you with videos. Thank you.